we
They
do.
sound so pretty.
I know.
I so.
Welcome. Mike, I'm so. Oh, are we live? Yes. That's the very things they say don't do. I'm like, yeah. Okay. Now we're live. Yay! Welcome.
Thank
Thanks
you.
for
I'm glad to
coming.
be here.
We're super excited. So, if you're joining us, go in the comment section and say who you are, because we would like to meet you. I am Victoria, and I'm a certified midwife. I'm a childbirth educator and also a birth coach. And today we have someone very exciting. We're going to be learning about breastfeeding. Is breastfeeding still relevant in 2020? And so I would have Susanna introduce herself.
I'm Susanna Smith. I'm a midwife here in York, Pennsylvania. I'm also a CLC, which is a certified lactation counselor. So I've been trained to teach and help with breastfeeding issues for families and for professionals. I'm also a childbirth educator. Most midwives are.
Yeah,
hopefully,
because you
right?
teach and you,
Right.
so it's not like you're just this and
Right.
you know that.
Yep.
Yeah. I love that. I love that. So Susanna is also a midwife. She's also a birth coach, a doula. And we're so excited. So today, my first question is breastfeeding relevant? Is breastfeeding relevant? And before we dive through that, before I have you answer that, I just want to say we have a free gift for you at the end. So if you stick to the end, you'll know what your free gift is. So stick to the end. Let us know who you are, and let's get started. So what do you think?
Breastfeeding in 2020, especially now with the times the way that they are, I think it's even more important for us to be supporting and teaching good breastfeeding to our families.
Absolutely.
With the way things are, there are people who are out of work, people who can't leave their homes, and that in some places may mean less access to potable water or fresh water, or having issues when you see places like Flint, Michigan, where your water is not safe. You need to be able to breastfeed a baby.
Absolutely.
So if you don't have fresh water, you can't make clean, safe formula. So breastfeeding now more than ever is super, super important, especially, if you've got situations where you may have a parent who has COVID and they're too sick to breastfeed. You need access to breast milk from other people. So now more than ever, I think it's really, really important to be supporting and pushing for healthy breastfeeding practices.
Yeah. Thanks for sharing that. It's actually very interesting because for me, I feel like I think we're so blessed that we can feed our babies.
Right.
I think it's just such a blessing.
Yeah.
And with the way we're made, like you don't even have to pay to, like how we have to get food and we have to buy food and all of that. And of course, it is important for, pregnant women and women that are lactating to, have good food. But just the thought that even in like third world countries, if you don't have, access to like maybe a lot of food, you can still like feed your baby.
You will always make milk. Even
That's
you can
amazing.
your body will make milk before it feeds itself.
Wow.
So when you are lactating, the first thing your body does is make milk, and then it's going to nourish you afterwards. So those extra calories and things that we recommend are for you. They're for your body. They're not in order for you to make milk. It's because you will make milk and you're not going to get what you need to be nourished yourself.
Wow.
So you could be crawling through the desert with just sips of water. You're still going to make milk.
That's amazing. That is amazing. Let me ask you another question. So I've seen trends where like, a mom cannot make enough milk, and so she's like, can I like get milk from like my neighbor or from like a friend? What are your thoughts about that? Do you think women can share milk?
I think donor milk is an amazing thing to be able to have. One of my goals, my personal goals, is to be able to have a source of donor milk for those parents that end up needing that. I've come across situations where, maybe you have a horrible situation where mom has a baby and then she passes away. And how do we sustain that baby without having to go to formula if it was important for that family that they had breast milk? And so there are just like angels out there that make this huge abundance of milk, and they will continue to pump and store that milk away just so that they can donate it. So there are a couple local organizations that you can look to. Human Milk for Human Babies is one, and I can give you the links for all those.
Okay. So there will be links at the end of this video that will link up for all these resources.
Yeah. So Human Milk for Human Babies. Another one is Eats on Feets. They have different chapters in different states and sometimes in different counties. And there are usually, people that will go on there and say, hey, I have milk. And then they can get linked to other people on there that say, hey, I need milk.
Love it.
So
love it.
Throughout history, babies have survived by being able to be wet nursed or to be donated milk by other mothers if there's a reason that the baby can't nurse from its parents. So donor milk is life-saving. It's amazing, and lots of hospitals now are actually using donor milk in place of formula in those situations, the NICUs and things. So
that's
super
amazing.
important.
That's amazing. Just to recap, if you're just joining us, that this breastfeeding free event is for birth workers, all birth workers, midwife, labor nurses, doulas, childhood educators, lactation consultants, counselors, and also this is also for new parents. So if you're a new parent, stick in there and hear and be inspired and be educated. So I have another question for you. So for new moms, if I am a new mom and I'm wondering when will my milk come in, like when will it come in?
So typically after birth, your milk's going to come in between days 3 and 5 after your baby's born. So when your baby's 3 days old, 4 days old, 5 days old, that's usually when you start to feel engorged. You get really full, really uncomfortable. That's typically when you see it. Sometimes if you've had a traumatic birth or a cesarean section, that can delay it a little bit. So you may see milk come in day 5 or 6 in those cases. But it's not terribly abnormal for it to take that long.
And that's interesting. Like I love that. When they say, okay, let me put my mind straight. So when they say your milk comes in, does it mean before your milk comes in, there's nothing? Like your baby's not being fed?
So your body starts to make what's called colostrum. Anywhere from like 20 to 24 weeks, your body can start making that when you're pregnant. So that by the time baby's born, you're already ready to give them. And it's like a thick kind of pasty type milk. And it's really, really full of fat. So that's what sustains your baby for those 3, 4, 5 days before your milk starts to transition and come in. And when they're first born, you and I both know they have this tiny little belly.
Stomach,
so they only need a few drops, but it is important that they get that. So,
Yes. I know some of the importance of colostrum is that it has antibodies and all the stuff your baby needs. Really, it's golden. Like it is golden. So I hope you guys can hear us. We hear someone said they cannot hear us, so we'll just try to.
We'll just be louder.
So let's know if you can hear us now. So colostrum is amazing. It just has everything your baby needs.
It's life-saving.
Another question that I have heard is how you know my baby's getting enough, especially those first few days before your milk just really comes in.
That's a great question. A lot of new parents, when they first start breastfeeding, they're just, they don't know, am I doing this right? Is my baby getting enough to eat? And just as birth professionals, we look for a few things. Is your baby waking to feed every 2 to 3 hours? If you have a super sleepy baby, sometimes they just need a little bit more milk to get those calories. Are they having wet diapers? Are they having poopy diapers? So you need to see both. Gaining weight, wet diapers, poopy diapers, those are like our 3 signs that your baby's getting enough milk.
So gaining weight, poopy diaper, and wet diapers.
Wet diapers.
Okay, so it's like what you take in is what comes out.
Yeah.
Just like for us, older people, if you eat stuff, has to come out. If it doesn't, then you're probably constipated.
Probably, or you're not eating.
You're not eating. Okay. Yeah. Wow. Okay. So if you guys are following us, just give us a like so we know that you are following and that this is making sense to you. And if you have any questions, leave those questions below because we will get to questions when we get to the end of this session.
Sure.
So go ahead and give us a like if you're enjoying this. And also go ahead and invite your friends. This is going to be amazing. I'm loving it already. So let me ask you, as a midwife, lactation consultant, counselor, what are some of the questions you get, especially from new parents?
From new parents, the biggest question that we just talked about was, is my baby getting enough milk? And like I said, weight gain, wet diapers, poopy diapers, that's how you tell your baby's getting enough milk. Are they growing? Are they having longer wake times as they continue to get older? Another question I usually get is, my baby cries all the time. Cries all the time.
Ooh, okay,
What
that's
do
a
I
big
do?
one.
Right. That's a huge one because
Yeah.
a lot of times, so there are so many reasons why babies cry. Sometimes it has nothing to do with your milk. Some babies just cry.
Yeah. That's the way they communicate.
That's how they know. So important things to calm your baby down to make sure that your breastfeeding journey goes well is tons and tons of skin to skin. Even if you can't have skin to skin immediately at birth, the moment you possibly can hold your baby, just hold your 24 hours a day if you can.
Wow.
So that is super important for breastfeeding because that skin to skin, there's a hormone exchange that happens through the skin, and it actually starts your baby's digestive system.
Wow, that's
through a
new
hormone
information.
exchange.
Wow.
So those digestive juices start flowing in your baby's tummy, and it creates the need to eat. It makes them hungry. It makes them want to nurse, and it's kind of this instinctual, that's how we survive. By starting the process of getting hungry. And so that's what skin to skin can do. So it can help you very much on your breastfeeding journey if you just hold your baby as much as you can.
That's amazing, guys. Yeah. Like, that's really amazing. And if we think about this, like, physiologically, like, your baby is in you for 9 months.
Right.
They're, like, in you, like, constantly, 24/7. And then they just come out, and you're like, I'm sorry.
Like, I'm going to put you way over there.
You're like, what?
Right. They've never been alone before. Never. It is impossible to spoil a baby.
I love that you say that.
Hold your baby 24 hours a day. If anybody, sometimes even my own grandmother said, you need to put that baby down. You're going to spoil that baby. No, you can't. You can't.
I love
if
that
you want your baby to sleep well, hold them all the time.
Wow.
All the time.
I love that.
Yeah.
Because in my culture, I'm from Nigeria, by the way, and like people will literally say that. They will say that. Don't hold your baby too much. You're going to spoil your baby.
Hold your baby.
But your baby was inside you like all the time.
They could hear you. They can hear your heartbeat. They smell you right away when they come out. So for them to be alone is got to be a pretty scary thing. Yeah. So hold your baby all the time. So lots of crying can be curbed by tons of skin to skin, which helps their tummies, which helps them get hungry, which helps them want to nurse more frequently and nurse better. The other reason we hear lots of crying is, I think my baby has colic.
That's a big
one. So colic is a pretty delicate thing to dive into.
May I just interject there?
Sure.
So if you've heard that before about just what we just touched about not holding your baby, give us a like in the comment section, because I think that's like just something so huge. And I thought it's just, my country just does that. But
no, it's everywhere. Everywhere.
Like everywhere.
People hear it all the time.
If you've heard that before, let me know. Give us a like button. Give us a wow. A wow emoji. And if you think Susanna is doing great, give us a like too.
Yes, I like those. So,
colic.
Colic is, a lot of people diagnose their baby with colic because they cry a lot. Well, there's lots of different reasons why babies cry. A lot of people think that colic is linked to cow milk. If mom is eating lots of cheese, drinking lots of milk, lots of cream in her coffee, eating lots of ice cream, they'll say my baby's lactose intolerant. It is impossible for a baby to be lactose intolerant because unless they have this really rare thing called galactosemia where they're actually allergic to your milk. That is so rare. I've never seen it. I've never come across it. I know lots of lactation consultants who've never actually seen it either. Wow. That's how rare it is. But human milk, our milk, has the highest level of lactose in all animal milk. Because lactose is what grows our brain.
Wow.
And because we can walk and talk and we're considered the best of all the animals on the planet, we have the highest level of lactose in our milk because we have the biggest, most important brains. Yeah. So your baby's not lactose intolerant. What it usually is linked to is the whey proteins in cow's milk. So the whey, when you separate the curds from the whey, that's how you make cheese.
Yeah.
And the whey is that watery part. And all the proteins in that whey is what your baby might be sensitive to. So some people might need to eliminate everything with dairy, even down to white bread that might have milk in it.
Wow.
They may be that sensitive. And other people may find, as long as I don't eat cereal or ice cream, my baby's fine. And I can have cheese, I can have yogurt. That stuff doesn't bother my baby. So every baby's different. And a lot of people will go and they just want to eliminate everything from their diet right away.
Wow.
And the best thing to do is take a deep breath. If you've got a baby that cries a lot and you think it might be a dairy intolerance, write everything down that you eat for a few days. Write everything down, write down the time, and then write down when your baby starts having their fussy period. And usually after a few days, you might be able to link what they're eating and what you're eating and when it bothers them. So every baby's different, just like you and I. Maybe if I eat broccoli, it hurts my stomach, but you're fine with it. So every baby's tummy is different too. They all have different tummies when they're born. So I like to tell people to just relax and let's write everything down and let's see if you notice a correlation with something you're eating. And if you do, let's take that out. Eliminating dairy from your diet can take like 3 weeks before you see any results. So that can be frustrating for a lot of parents when you say, okay, let's eliminate all your milk, all your cheese, all your yogurt, eliminate dairy, because maybe we see that is what seems to be causing the problem.
Wow.
You need to do that for 2 or 3 weeks before you're going to see any results. So it's not overnight. So you're looking at another couple of weeks with a fussy baby before it's completely out of your system and not bothering their bellies anymore. So patience is really important.
And you need it in bringing up, nurturing of the children anyways. Even in life, patience is a virtue.
Yeah.
So I really like the practical, the practical thing you have them do. Now, like you say it again. So you have them, if someone is having like a colicky baby, what would you have them do?
First, we try extra skin to skin.
Extra skin to skin.
Maybe an extra feeding.
Extra feeding.
Sometimes it's because they're hungry and you think they're fussy all the time, but maybe they're just a little more hungry.
Wow.
So you can't really overfeed a baby when you're nursing. So skin to skin, extra feeding. If we feel like it's something you're eating, let's take a deep breath and start doing a food journal and keep track of everything that you eat for 2 or 3 days. Keep track of the time you eat it, what you eat, how much you ate. And then also keep track of the time of the day that your baby is really fussy and see if we can link one of those things together. And then we can start eliminating those things from your diet and checking the labels of things in your cabinets and see if we see something there and hopefully work that out.
I love that. I love that. I really like just how practical you were with write stuff down and see the correlation.
Right.
Because sometimes you're so oh, this is just bothering me. I need this baby to stop crying. And so what do I do? And people just start doing stuff. So I like how you you teach them, you give them power, you empower them.
Yeah.
And have them write stuff down and see correlation.
Right. And they can I like to teach them let's help you diagnose what's going on with your own baby. So it kind of helps with that instinctual parenting of recognizing when your baby's uncomfortable, knowing what's wrong with them and figuring that out. And that you need that skill forever. When you have kids, forever.
I love that. Wow. Well, that's it. If you have a colicky baby, extra skin to skin, write down journaling. Journal, see what might be causing it. Maybe when during the day does your baby cry more? Is it maybe what you're eating? Or is it maybe the baby's just more hungry? Because they go through a growth spur.
Yeah.
So it can also be that. So, so make sure you try these things out, especially if you're having a colicky baby, because I know it's now fun.
Yep.
It's now fun to hear your baby cry. So I hope this was helpful. If this is helpful, go ahead and say helpful in the comment section, and let's go to our next question. So I have some questions written down here, and my first question is, what are some of the things, or my other questions, I've been asking questions, what are some of the other things that people can do to boost their milk supply? Because I know there are moms that really, really, really struggle with getting enough milk for their baby?
So boosting your milk supply, the very first rule in breastfeeding is supply and demand.
Mm.
So you've got to be feeding your baby often enough to make more milk.
Mm.
So, you know, if you're feeding your baby every 2 hours, 24 hours a day, which is pretty normal for most of us,
Yeah.
you should be making enough milk. If you start to notice that your milk is dipping, there are lots of things that can affect that. It could be maybe you're a little dehydrated. Please, I can't stress this enough. Don't believe when people tell you that certain colors of Gatorade are better than others. I hear this all the time.
Oh,
Or
okay.
that specific lactation cookies are better than others. There are so many things that can boost milk supply, but there are a lot of wives' tales out there too.
Yeah,
So
I'm
more often than not,
sure.
if you hear, oh, I drank a container of blue Gatorade every day and it really boosts my milk supply, you were dehydrated. So hydration,
Mm.
right?
Mm.
Making sure you're hydrated, making sure you're feeding your baby often. Another thing that can start to affect milk supply a little later on is when you start to get your menstrual cycle back.
Wow, that's a good
A lot of
one.
moms will see a dip in their supply when their menstrual cycle comes back.
Yeah.
So if you're one of those people that's fortunate enough that while you're breastfeeding, you don't really get your period.
Good for you.
Yeah. Some people, I was fortunate enough. I would go a couple of
Aw,
years
you're
before. I am
blessed.
very blessed. But people can use power pumping during that time. I can find you a video to link if you want for power pumping. Power pumping is something where you take like an hour out of your day or in the evening, usually after baby goes to bed, and you would pump for 10 minutes, rest for 10 minutes, pump for 10 minutes, rest for 10 minutes. And you'll do that, and then you take a little bit longer break, and then you do it again. So you are kind of triggering your body because while you're feeding or while you're pumping, your prolactin levels and oxytocin levels tend to go up and down while you're doing that. So that allows your body to get those signals to make more milk. So kind of triggering that in small bursts is really good for your body. So power pumping, hydration. There are a lot of galactagogues out there. Galactagogues are things that can, like herbal supplements that can boost supply. One that I see lots of people recommending is fenugreek. That can have a wonderful effect on some people and a very adverse effect on others. So if you've never used it before and you want to try using that, I always say, you know, really pay attention to your supply, because if you start to notice it get worse, it's not right for you.
Okay.
And you would want to stop using that.
Okay.
Things like herbal teas can be wonderful because they're nourishing. So you want a good nourishing tea, something that's got nettles and alfalfa or oat straw. Fennel is really good. So that kind of thing, plus it's extra hydration. So sometimes was it the tea or was it the hydration? But having good hydration and good nourishing foods is really good for your milk supply too. So always be kind of leery about people recommending like really expensive store-bought things. You can usually find what you need just at your regular grocery store.
Wow.
Yeah.
And I know that, like, for people here where we are, you sell pregnancy teas, right?
I do. I have a line of teas called the Belly Warmer. I have like teas for reproduction. I have teas for pregnancy.
Nice.
I do have lactation teas. I have one with fenugreek. I also have one without, because I know that can have adverse effects. I also make nipple balm for when you are a new breastfeeding parent and you may be chapped or cracked and bleeding. So yeah, I like to support everything from pre-pregnancy to menopause.
Yeah. I love that.
Yeah.
I love that. So how can people get your teas?
My teas, you'll have a link to my York Birth Services website.
Yeah.
There's a link on there to go to thebellywarmer.com.
Okay.
And that is where you can order the teas.
Okay.
Yeah.
So I would leave a link below. When we are done with this, I'll leave a link so that you guys can, go there and get your teas. Because I also know that sometimes, you go to the store and you just, grab a pregnancy tea.
Right.
But maybe it's been sitting there for like a long time.
They're usually not really full of as much nutrition as you need from those herbal. You want a nice, nutritional herbal tea. So you want things that are good for building blood supply, because your body kind of recognizes making milk the same way it does making blood when you're pregnant. You need extra hydration, you need extra nutrition, you need a little bit extra sodium in your body. All those things are good for making milk.
Great. I really like when you say hydration. I think hydration is such a big part of it because milk. What does milk has? Like milk is literally
It's
not
88% water.
water. So how are you gonna make something
Right.
if
You need to be. I'm always so underhydrated. Even I have a hard time striving to get 3 to 4 quarts of water a day.
You know, it can be hard.
It can be very hard. So a good practice for breastfeeding is wherever you're going to be sitting the most in your house, create a little area there for yourself. Make sure you have bottled water or some snacks.
Talking about water.
Right. So you can support yourself, or, even if you have little kids, send them on an errand to run to the refrigerator and get you a bottle of water, or get you, a glass of water from the kitchen. That helps kind of involve them in your breastfeeding when they can't be climbing all over you. But yeah, setting yourself up before, making sure that you have a place where you can sit and have a charger for your phone and something to snack on and something to drink and a warm blanket, so that once you sit down to breastfeed, you can stay there for an hour if you need to.
Yeah, absolutely. I love that. Thank you for that. For those that are just joining us, if you have any questions about breastfeeding, go ahead in the comment and just leave your question and we would answer them. So go ahead and leave your question. Yes, someone said, yes, drink more milk, lol. Yeah.
It could, as long as your baby lets you drink milk without them crying so much, then yeah, that would help too.
Yeah, absolutely, absolutely. Another question I have is, when moms are breastfeeding, we actually just had a mom that it was my first time seeing someone be in so much pain. I went for a postpartum visit and she was like, my breast is sore, my nipple is sore, and we're like, okay, let's see. And so she had the baby and brought the baby, and she was like biting her tongue, and I'm like, just stop.
Right.
Like, she was in so much pain.
Right.
And later on, we saw that the baby had a lip tie, and the baby was just, of course, just on the nipple,
just
and
nipple feeding, not breastfeeding.
Yeah.
Right.
So what do you have to say about that? Like, moms that are in pain, what should they do?
Everyone says that it's normal for breastfeeding to be maybe a little painful in the beginning. It's normal for that sensation to feel different. Sometimes it can be a little painful. It can be normal to get a little dry or chapped. It should not stay that way. It shouldn't be painful. You shouldn't be like wincing every time you put your baby on, or bleeding or in pain. If you have that kind of issue, you need to either talk to your midwife, or if you had your baby at a hospital, almost all hospitals have like a hotline to call to speak to an IBCLC. An IBCLC is an international board certified lactation consultant. And so they go for a medical board exam. They're trained specifically in lactation. They're there to recognize all kinds of adverse effects that bad, poor latch can have on your supply. And their experience, that's who you want to go to, and they can assess your latch. So you would go and see them. They would watch you feed your baby. They would help you reposition, help show you a better way to latch so that your baby can latch better.
Absolutely.
They don't diagnose lip ties and tongue ties, and neither do we as midwives. We don't really diagnose it, but we can look at it and say, you should go see a pediatric dentist about this.
Absolutely.
Because we know what they look like.
Yes.
So seeing an IBCLC or talking to your midwife, or if you can't have access to either one of those, go see a pediatric dentist or an ENT, which is an ear, nose, and throat doctor. Sometimes they can check for lip ties and tongue ties. Ties do affect your milk supply. They affect your feeding. It can be very painful. If your baby's not latching on correctly and eating well, they will not thrive. And then your supply will go down because they're not demanding. There's no supply and demand.
Look at that cycle.
Right. So when they're not draining your breast completely of the milk, you're not making more.
Wow.
And your supply starts to go down while they start to lose weight. And then it just becomes like this cycle of painful breastfeeding. So the best thing you can do is, if you have any concerns, if it's still painful, find your local IBCLC. A simple Google search is easy to find one of those, or calling your hospital and asking them to send you information for one.
Absolutely.
They can be life-saving as far as breastfeeding is concerned.
Absolutely.
Yeah.
So what I'm hearing is that if breastfeeding is painful, seek help. Get
Yeah,
help.
get help.
Breastfeeding should not be
It
painful.
should not be
It
painful.
should
You
not
should
be
not be
painful.
crying when your
Mm,
baby is latching on. It should not hurt.
I like that.
Yeah,
It should not hurt.
yeah.
One I learned two things when I was studying a bit about this.
Mhm.
It says one of the problems could be if breastfeeding is painful for you, could be first attachment, or
Mhm.
it could be position. So the way the
Yeah.
baby is latching on, or the way
Mhm.
the baby is positioned.
The way the
Tell
baby's
us a bit
being
about
held.
positions.
So positioning, the most important thing is you always want to be tummy to tummy with your baby. So whether you're holding your baby like this
Mm,
or you're holding your baby up and down,
mm,
their tummy should be against your tummy.
mm.
So, if you hold a baby on their back, you're cradling and they're on their back, then they're turning their head like this to eat. And that's really uncomfortable. I can't
Yeah.
imagine having to like turn my head
And
completely
eat.
to the side because I'm laying on my back trying to eat like this.
Yeah.
So tummy to tummy allows your baby to be like facing straight on at your breast. Let their hands free. If you swaddle them, unswaddle them when they're eating.
Mm.
So you want them to be able to hold onto your breast because they naturally will need your skin to
Yeah.
help bring that milk out.
So,
So tummy to tummy, let their hands be free. You also want their nose and chin really close to your breast. So it will almost, you'll feel like, oh my gosh, they're so close. I'm afraid I'm going to suffocate them. You're not.
yeah.
A lot of bigger chested women have issues with that. But just keep an eye
Yeah.
while you're feeding.
Yeah.
But you want them to be nice and close. And um, there are actually, I have a link to a good video for lining up for breastfeeding that I can
Great.
give you too.
Great.
When you're holding your baby and getting ready to breastfeed, the most important thing is to line your nipple up with their nose.
That's a
So
good one.
I don't have my doll with me because I didn't stop by my office before I came. But when you hold them, make sure that your nipple is in line with their nose because they naturally tip their head when they open their mouth.
That makes sense.
Right?
Yeah.
So tipping their head to open puts your nipple right along the roof of their mouth, and that's where you want it to go in. It's very much easier said than done because when they go to latch on, there's hands in the way and baby's crying.
Yeah.
If it gets so overwhelming and you feel like you can't do it, stop.
Yeah.
Have some patience. Hold your baby skin to skin. They will calm down, right? They won't continue to cry forever. Calm your baby down first. Yeah. Calm your babies down first because if you're upset and they're upset, nothing's going to work.
Yeah.
So everybody take a breath and do some skin to skin, calm your baby down, and then try to latch again.
We actually have babies there that we can use. But I just see that we have a lot of men here, and I'm really, really excited. Like, I'm so thankful that
I love
men
that.
wants to be involved.
Yes.
So
that's really important.
How can men be involved in breastfeeding? Like, how can our men, our husbands, our brothers can be, supportive to breastfeeding?
It's important if you understand how breastfeeding works and you can look up the different ways to hold your baby. Understanding that the person that is breastfeeding needs extra water, something to eat. So whenever they're breastfeeding, get them something to drink. Get them something to eat. Be the one to go ahead and change that diaper if they want to change a diaper in between switching to the other side, if that's what they're doing. You can even sometimes help baby latch on. Sometimes in the beginning when you're new, it takes 4 hands to hold the baby right, and somebody needs to hold the breast and the other person can help push the baby on. So help. Put your hands in there and help. Yeah.
Help.
Yeah.
And it will develop that bond too, not just with, your wife and the baby, but also you as a husband or you as a brother.
Skin to skin. Skin
to skin with the baby.
Yeah.
So daddies, brothers, you can also be you can be part of this. Yeah. You're all part of this. This is your family.
Absolutely. There's scientific studies that show male partners of the pregnant person, their testosterone levels actually go down during that pregnancy. And it's almost nature's way of like designing them to be a little more compassionate and a little less rough.
Wow.
So that they will love their babies.
Wow.
So
if this is new information for you, I want you to go ahead and give this a like just thumbs up. Like I think this is great.
It
is
so
amazing.
Lots of like partners doing skin to skin. If baby's really crying and can't latch on, and sometimes you're upset and you need a break and take the baby, walk away, and you do the skin to skin. Dads do the skin to skin.
Wow.
Calm that baby down and then go give them back to try and latch again. It's really
I love
important
that.
for lots and lots of skin to skin. So
So
doesn't matter who
husbands,
does
that's it.
Yeah.
That's it for you. You can be involved. You can be part of
Yeah,
this journey.
absolutely.
You can do a lot to help your
Yeah.
wives. You can be part of
Yeah.
this whole bonding. This is
Yeah.
for families.
If you have someone that needs to pump after feedings, if we're trying to do that power pumping to boost supply, or they're trying to pump to put milk in the freezer because they have to go back to work when baby's 6 weeks old, you can be the one to hold baby and love baby and take care of baby while mom is pumping, and give her that break to be able to do that without having to hold a baby and do pump at the same time. Yeah, so lots of opportunities to help.
Lots and lots and lots and lots of opportunities. Yes. So I really like that because for me, one of the reasons I love breastfeeding and I love, caring for women and their family is just the bond I see, in the family. Like
Yeah.
I want to see not just the mom feeling like she's going through this amazing special period of pregnancy
Right.
and having a baby, but also the dad feeling the same
Right.
way. Because I know a lot of times dad feel like, they are alone. They are, it's just a wife that, only the
Right.
wife comes to see the midwife or goes to see the dog.
Right,
And,
right.
and so it just feels so lonely, that journey. And for me, I love to include men.
Yeah.
We
Yeah.
even encourage men to come
to
come with
catch
their
their
wife
yeah.
to
Yeah.
prenatals, and also
Yeah.
to catch their babies
Catch
if
their
they want
babies.
to, with us
Right.
being there.
Right.
Cut
That's why
the
I love
cord.
home birth. My husband never got to catch any of our babies, and he still to this day is like, I would love to. I wish I could. And I told him, I don't think any of my clients will let you catch their babies, but it's amazing to see new dads born. I look at birth like a family has just been born. So moms are born, dads are born, and they can help that support in that very first time baby breastfeeds after birth. I usually encourage dads to be the one, go feed your wife, get her something to eat, and you'll see dads sitting down and spoon feeding them oatmeal or yogurt while they're doing that first breastfeeding, and they can see what that looks like and be a part of that and know how to help their partners with their breastfeeding. So yeah, it's important.
Yes. I love that. I remember some of my experiences with dads that are really, really very involved in, their wife's care. I know at the end, some of them at the end will cry. And when they cry, that just makes me cry.
I know. Me too.
Okay, I cannot be,
Me too.
I just need to let it out.
Yeah.
And just seeing like, they feel like a more special bond to this, to this woman. Like she's done this amazing, powerful thing. And
they look at them very differently after that.
Differently. And I feel like it could be the same way with breastfeeding,
Absolutely.
if they're part of this journey. It's just like bonding for the whole family.
Yeah,
this is amazing. This is our family that is growing.
And it's important. I think this dad's doing skin to skin is not just for giving us a break from the baby. It's a way for them to bond with that baby, because it's pretty normal for some partners to go and start to feel like, well, I'm not feeding this baby, so they don't ever want me. Get your baby.
A big one.
Get your baby used to you being their comfort. Get your baby used to you picking them up when they're crying and calming them down while your partner's getting ready to breastfeed. So being that comfort, they will know your face, they will know your voice, they will know your heartbeat, they'll know your smell, just like they do mom. And being involved in just that aspect of like getting them ready to be breastfed and holding them and calming them helps secure your bond with them, so that they're not, babies tend to want mom, and little toddlers tend to run to mom when they're crying or want something. But starting out right away by being that comfort for them allows you to always play a part in
that's
everything.
so deep. I love that you mentioned that. And by the way, go ahead, if this is making sense, dads, brothers, soon to be dads, go ahead and say makes sense in the comment. Go ahead and type that so we know that you're enjoying this and these tips are helpful to you. It's interesting to know, because I know some families that feel like, oh, she's just a daddy's girl, or he's just a mommy's girl. And sometimes the other partner feels like, oh, the baby doesn't
they
like
don't want me.
They don't want
right.
me. And this is one of the ways they can want you, because
Right.
if you're not part of their care, I mean, if I don't
Right.
know you, I don't know you. Like, you
Right.
never
You
talk
have
to
right.
me, you don't
You have to hold
communicate.
me all the time for me to know who you are. Because, you know, you will start to see babies when they're 4, 5, 6 months old. They start to go through that, like, they will look at someone like they'll cry if someone new
Mm,
holds them. They don't really want to go to different people. So be there all the time.
be
You have to
proactive. Go
be and you
ahead.
have to be present. You have to hold them. They have to know who you are. So yeah,
Mm,
that's really important.
love that. Be a
Yeah.
present dad.
Mhm.
Yeah, be a
Yeah.
present dad. Yeah. This is just amazing. So go ahead in the comment section. If this is making sense, go ahead and say making sense. So we
Mhm.
know to keep going. I just really, I really love that. I know also that, you know, with this whole thing, you know, when dad feels like first during the pregnancy, you know, yeah, this is just my wife and all of
Right.
that. And then birth happens and it's like, oh my goodness, you know, she's changing. And then there's this baby and then there's like this connection, like, you know, the mom has to feed the baby. We recommend every 2 to 3 hours.
Right.
And so it's like you feed it you feel like you're just done feeding this baby and then you're back feeding the baby. And
Right.
so it's tiring, it's exhausting,
Mhm.
it is overwhelming. I mean,
Right.
you're happy, but then partners just feel like
Left out.
they just feel left out.
Yeah.
And this is,
Yeah.
I just think
Yeah.
this is a
So
really amazing
being
way.
being educated on breastfeeding, go and take a breastfeeding class with your partner while during the
Educate.
pregnancy. Go learn about breast milk. Learn about ways to help with common complaints in breastfeeding. Learn about those galactagogues and good, you know, herbal teas that you can buy for your breastfeeding partner. And lots of skin to skin and holding that baby, and you'll find that knowing what it's going to be like and playing a part in that um, just keeps you close to your partner, because that's important too when you have this new baby kind of tearing your house apart and ruining all
Yes.
your sleep and everything's a mess. Being close to your partner because you understand what they're going through by educating is important.
Yes. I love that. I love that. Well, I wish we could just go on and
I know.
on, but our time is running out. If you have a question, go ahead and write it and type it. There are no stupid questions or dumb
Yeah, no,
questions.
never.
So
There's
this
never a
is time
stupid
for
question.
questions from you guys. Those that are live, if you want to go ahead and put questions down. And I'm just gonna have Susanna tell us some of the things she does, so that you guys can go ahead and follow her.
Yeah.
And yeah. So go ahead and
So
tell us.
I do, with COVID right now, I've had to put a pause on my group classes, but I do teach local breastfeeding classes for doulas and birth workers and midwives if they want to come. And I teach another class that's for parents who are maybe had breastfeeding problems in the past, or they're going to be new parents and they want to know everything they can to prepare. So I usually, you know, once things kind of settle down with COVID, I'll have my schedule back up on my website for those local classes. I do also, I'll teach private classes for breastfeeding right now. If someone wants to contact me, I will come to your home and teach a private class.
Great. Are you doing virtual ones too?
I can do virtual ones. I know haven't.
They're not that easy.
Right.
But...
It's hard. It's hard to do virtual ones, but I do. I can. Yeah. I can always try to do that. Okay. And I will soon have up on my website lots of breastfeeding resources for parents. Yay. I'll give you some of those.
Thank you.
There are some great books that people can get for breastfeeding. One of my favorite things is La Leche League.
Oh,
they're all over the world, really. Yeah. But La Leche League has a book called The Womanly Art of Breastfeeding. You will probably not read it cover to cover, but it's a great book for parents to have as a resource. Wow, so it gives you lots of things to look into. If you're experiencing this, it might be this, and it's a great book to start out with breastfeeding. And I do have a couple people I follow on Facebook that are doctors, that are specifically breastfeeding doctors. So yeah, I can give you links for those too, and lots of resources.
Great, great. Thank you, Susanna.
Thank you. I'm so glad. It's my second love. Breastfeeding's my second love.
I love it. I love it. And if you want Susanna to come back, because I think we have to do this again.
Yeah, we should.
We should.
Totally. We'll talk about everything.
Oh yeah, everything. So if you'd like Susanna to come back again, go ahead and say, come back again. Mm-hmm. Come back again, Susanna.
I would love to. I'm so glad.
it will be exciting. So I also just want to say, for your free gift, if you've watched all the way unto the end, go ahead right here on my page. You would see the free download to some of the my favorite birth tips to help you birth with confidence. I'm a childbirth educator, like I said. I'm also a midwife, but I also am a birth coach too. So go ahead and download that. It would also, make you so it will send you through a link, and you'll be able to also get on my email list, so that whenever free event like this is coming up or some other exciting project, I can let you know first. So yeah, I'm so thankful that you guys were able to join us, and I look forward to our next free
we'll do
event.
it again.
Yes, let's do this again.
I will. I'd love to.
So see you guys.
Bye.
Bye. Thanks for watching. Oh, by the way, go ahead to my YouTube channel. I'm also gonna put this on my YouTube channel,
Awesome.
and I think there'll be a replay here too. So
yeah, good.
Yeah. So see you guys. God
Bye.
bless
See you next
Thank
time.
you. See you next time.
Yay! Thank you.